The Center for Disease Control is issuing a health advisory after seeing an increased number of RSV cases recently in southern states. News 12's Jolie Poole spoke to a local doctor to find out what's going on.
A new warning from the CDC cautions parts of the southern United States, including Tennessee and Georgia, about a rise in the number of RSV cases. The officials I spoke with say typically RSV isn't life-threatening, but it does hospitalize more than 2 million children each year.
RSV is a common respiratory virus. It's named respiratory syncytial virus. RSV in general causes common cold symptoms, so generally upper respiratory tract infection, which includes cough, congestion, runny nose, can have conjunctivitis. Some patients, and the younger the patient, the more likely it can spread into what's called a lower respiratory tract infection. And that is where you get the increased work of breathing, struggling to breathe, low oxygen levels, and more serious infection.
Doctors say that normally RSV is rampant during the winter months, but thanks to masking up, the majority of cases were absent this year and are just now appearing.
With the masking and with the distancing and everyone staying away from each other, we really did not see RSV this winter. With the economy opening back up and everyone going back out and enjoying their lives, we didn't see RSV at all this winter. So we're kind of seeing it now that people are getting back out and being active again.
RSV is typically spread by respiratory droplets and can be life-threatening to newborns, infants, and adults over the age of 65.
The risk for babies is that they have their airways are small. So this virus causes inflammation, causes damage to the lining of the airway, which can lead to blockage of the airway. And then the older patients, just as they have increased morbidities with different other lung problems, are at more risk also.
Currently, there is no medication to cure RSV. Medicine can only treat the symptoms. It can, however, be prevented by washing hands and covering mouths and noses when sneezing or coughing. The CDC is encouraging clinicians and caregivers to consider testing for RSV when the COVID-19 sample comes back negative. For more information about RSV, go to our website, WDEF.com. In Chattanooga, Jolie Poole, News 12 Now.